My name is Dr. Titus Mutwiri. I am a medical scientist. Basically, I spent quite some time teaching at the university. I'm a lecturer at Kenya Methodist University, the School of Medicine and Health Sciences, and a member of the Department of Medical Laboratory Science. When I am not teaching, I take another assignment given by the government as the chair of the Kenya Medical Laboratory Technicians and Technologists Board, where we regulate the medical laboratory profession in the country. When I am not teaching at the university or probably not at the board, I indulge myself into communication because I am a fan and I have a penchant for communication and leadership. And when not doing that, then I lead sports as the president of the Baseball Federation of Kenya to influence young people to become better versions of themselves through sports. Besides that, I do family. The Kenya Medical Laboratory Technicians and Technologists Board was established by the KMLTTB Act, that is the Medical Laboratory Technicians Technologists Act number 10 of 1999, promulgated in the year 2000, and with the sole responsibility of regulating the training and the practice and the employment of medical laboratory technicians and technologists in the country. So the board that I chair supports the management of KMLTTB to ensure that they do their work well and to ensure that the medical laboratory profession is well regulated. So we do index students right from college or universities and follow them through as they undergo their training, and after they finish their training and graduate, we give them a qualifying exam which now enables them to be licensed to practice as competent medical laboratory technicians or medical laboratory technologists. That is the sole duty of the KMLTTB, but besides that, we also regulate the reagents and equipment that are used in the medical laboratory space to ensure that they are validated, and they definitely, or rather to check that they test what they purport to test through a process called validation. So we do validation of in vitro diagnostics, reagents, and chemical equipment and machines that are used in diagnosis of diseases within the country. For a long time, over 23, close to 24 years now, since when the board was formed or the organization was established, we got established through an act of parliament. But over time, we have experienced a lot of evolution, and we thought when we came to the board that it is time to work out some regulations to support the implementation of the act. So we have been quite busy ensuring that or working on regulations that will support the implementation of the act. And these regulations, of course, have got a very rigorous process, starting from making the drafts that will go for public participation before they go to parliament and before they are signed into law through a legal notice. And where we are going, the space we are going into, we will definitely see some of the processes more clearly outlined, not only outlined in documentation, but also well outlined in law. And the space of medical laboratory science, the space of diagnostics, the space of research in the country will take a different trajectory and will be more aligned into processes that are even clearer and anchored into law. So carrying out or rather drafting these regulations has been a great need at the moment, and I'm happy to say that I have seen the current board work very, very tirelessly on that, and we are going definitely to have some new regulations very soon. Besides that, the board is constituted by committees. We have the committee on finance, administration, and ICT. We have the committee on education and continuous professional development, and we have the committee on compliance and another committee on disciplinary. So these 4 committees have been working closely, and 2 ones are coming up with resolutions that will help and enable efficiency within the organization, supporting management to ensure that they do their day-to-day work effectively. And to this, I really commend them for a job well done. We are experiencing many challenges in the current world. New diseases are coming up, which have not been documented, emerging and re-emerging diseases, and a lot of changes happening even within the genetic environment. And we have experienced pandemics, and all this boils down into diagnosis, because we cannot do any treatment without proper diagnosis, quality diagnosis. And we are in a space where when you go to the hospital, you really need to, both of you, both the patient and the service provider, need to be confident that the results that I have gotten are very sensitive to the disease that I have or that I could be having. What that means is that development of tools that are able to properly define the kind of an infection that a patient has comes in mind and becomes a core component moving to the future. We are in a world where of course there is a need for saving time. There is a need for ensuring we use every available tool to ensure that diagnosis is done promptly and it is definitive and conclusive. And for us to get there, then we need to continually be more innovative. We need to be more inquisitive to the world of disease diagnosis. We need to approach that space with more defined tools that can help us get quicker results, but factual results and quality results. It's only by doing so that then we will have efficient treatment and reduce any form of guesswork when dealing with treatment of diseases in the hospitals. I'm looking to a future where medical laboratory officers will be put at the center of treatment, because treatment without clear diagnosis is guesswork. Treatment without a proper definitive diagnosis that is laboratory based is close to witchcraft. What we need to do is that we need to enhance our treatment capacity. We need to reduce the time that is taken for us to define an infection. And what that calls for is development of better tools, of course, not only within our country, but even at the global stage, and tools that can support a quicker definitive diagnosis. So 20 years is a long time, and too much will have changed in the world of artificial intelligence, in the world of robotics, in the world of nanotechnology, in the space of the 5th industrial revolution. Too much will happen. What we are looking at is let this too much be able to define and then give people assurance of better health. When someone is unwell, the cause of the illness needs to be known fast and upfront, so that that person can receive proper treatment through after proper diagnosis. Ideally, someone who falls in love with science, Of course, number one, you need to be good in sciences for you to become a medical laboratory scientist. So passing well in the secondary school level and then getting admitted into an institution of your choice. But when we get students there, one of the greatest inspirations that we ask them to seek is to see how they can be more inquisitive, how they can look out for mentorship from people who have gone ahead of them, how they can be more useful within at a very early stage in their lives to answer questions regarding diagnosis of diseases. And we have so many diseases cutting across all the fields or all microbial agents that we know in this world, and of course also affecting the body physiology and all that. And it is a student who is continually inquisitive and probing and wanting to create solutions that will be of benefit to our current and our future world. So every student who gets into college or university, and even after, they need to ask themselves, how can I be of benefit with the knowledge that I have acquired? How can I be of benefit to the well-being of the population? And how can I make that knowledge, skills, and competencies and put them into use? And even after they graduate from college, it is important that knowledge acquisition does not end. It's a continuous process, and that's why we have started a continuous professional development program to ensure that even after training, medical laboratory officers continually engage into systems and programs that enhance their skills, that enhance their competencies, that throw them into the paths of seeking to know more within their niche. And that way, they will definitely have a chance to ask themselves deep questions on how they can be of greater help within their profession. And we have many continuous professional development providers who have expressed interest to support these programs, whereby even after college, someone gets into enrolling into programs that will keep them abreast with the knowledge, that will keep them informed. Of course, because things are changing too fast at this time. Even the way diseases are presenting sometimes could be changing, and we need, as I said earlier, we need to have quicker methods, more sensitive methods, better tools of doing diagnosis within or doing research within the country. And this will call for scientists who are more keen into answering questions through the work they do on a daily basis. Because when we work within the hospital or in research or in training, we don't do that to just earn a salary. We do that with a desire to change a life. We do that with a desire to prolong life. We do that in a desire to ensure that when treatment will come, it will be definitive to the problem that has been realized in the hospital or within the laboratory. And that calls for just something beyond going through training and graduate.